Hi friends, this is Dr. Abdequaem Chimthanawala. So today I will discuss a very interesting remedy in relation to urinary complaints. I hope and I know that you must have used this remedy in your practice. If not, that means you have missed a lot of symptoms of this remedy. I am talking about COPAIVA, COPIVA in urinary complaints. सी व्हाट हैपेंस क्या होता है इन यूरिन कंप्लेंट्स के जो सिम्टम्स रहते हैं बर्निंग इन यूरिनेशन बिफोर ड्यूरिंग आफ्टर वट एवर सिम्टम्स वी हैव few remedies which are as good as specific and they give relief also, like we have cantheris, we have berberis, we have clematis, we have sarsaparilla. But my dear friends, अगर आपने कोपाइवा यूज़ नहीं किया तो आपने बहुत इंपॉर्टेंट रेमेडी मिस की अपनी प्रैक्टिस के अंदर. कोपाइवा is a very very important remedy, and the symptoms which I am going to tell you, please do write down in your Mathematica so that you never miss these remedies. Inflammation of the urinary bladder, especially in women. Now this inflammation can cause pain, it can cause burning, it can cause irritation, it can cause lot of things. Simple inflammation of the bladder in women. Think about COPAIVA. Especially in old women, you must think about COPAIVA, and you will get a lot of cases where the patient is about 70-75 years of age, comes to you with recurrent urine infection. You give medicines, any medicines, the patient is better, again the same symptoms. She takes antibiotics, for some days she is better, again the same symptoms. So inflammation of bladder in old women, a very very important remedy, COPAIVA. Sometimes what happens because of lot of inflammation, the bladder becomes thick. From psora to psychosis, the bladder becomes thick, and because as the size of the bladder becomes less, so it can accumulate less urine. So when the thickening of walls of the bladder is there, my dear friends, remember this symptom. Whenever there is thickening of the walls of the bladder, and that's why there is increased frequency of urination, because the volume accumulation of urine in the bladder is less, because the size has been minimized because of the thickening. Think about COPAIVA and think about Dalkamara. In COPAIVA, in this symptom, I have never failed in my practice. दोस्तों ध्यान रखिए, thickening of walls of the bladder. In COPAIVA, pain generally at the beginning of urination. So you will say pain generally in the beginning of urination. We have COPAIVA, we have a lot of cantheris and other remedies. COPAIVA is also there, especially pain in the neck of the bladder during urination. Think of COPAIVA, think of cantheris, think of epismel also, and other remedies. But pain in the neck of bladder during urination, or you can say in COPAIVA there is a spasmodic pain, especially in the morning, my dear friends. जब भी पेशेंट ने बोला कि मुझे बहुत कन्वल्सिव है, स्पास्मोडिक पेन है सवेरे के टाइम पे, थिंक अबाउट कोपाइवा. नो अदर रेमेडी कैन कम्पीट कोपाइवा इफ दैट सिम्टम इज इन द मॉर्निंग. एक चीज़ और, बहुत बच्चे हमारे पास बच्चे बहुत आते हैं और बोलते हैं कि डॉक्टर साहब मेरे बच्चे को जब भी सर्दी होती है, जब भी इसको ठंड लगती है ना, whenever my child suffers from coryza, whenever he catches cold, he has retention of urine. And once this symptom is there, or you can also say retention of urine from catching cold also. We have remedies, COPAIVA, we have Oconite, we have Pulsatilla, we have Dalkamara, but COPAIVA, a very very important remedy. It is also said that when there is urination, when it is dribbling, involuntary, in old people from catching cold also, अभी आप देखते हैं कि बहुत हमारे डैडी है, ग्रैंडफादर है, ग्रैंडमदर है, उनको सर्दी हो गई, खांसी हो गई और यूरिन बराबर नहीं आ, यूरिन बूंद बूंद आ रही, एंड दे आर very unhappy and become very irritable because of that. That is also, my friend, COPAIVA. Urination which comes by drops, involuntary, in old people from cold, COPAIVA, or you can say urination dribbling involuntary in old people, that is also COPAIVA, and cantheris is also there. So much so that if there is frequent urination from exposure to cold and wet, we normally think about other remedies like pulsatilla is there, but COPAIVA, my dear friends, is also there. A very interesting remedy. These symptoms are very, very important. One thing before I close COPAIVA is urine sediments is thick red. बहुत थिक रेड सेडिमेंट अगर यूरिन के अंदर आता है तो माय डियर फ्रेंड्स थिंक अबाउट कोपाइवा. So these symptoms of COPAIVA do see in your practice, because these symptoms you have seen in your practice, maybe you have missed out or maybe you have palliated the case with cantharis or sarsaparilla or epismale or sulfur, but don't miss COPAIVA if you have these type of symptoms. So my dear friends, if you like this video, do share and subscribe. Thank you.